Good afternoon. My name is Tommy Gibson, and I'm a member of the Wayne County Board of Health, and I represent that board, plus our brand new director, Dr. Brenda Weiss. I'm here to congratulate the 21 young men and women of Wayne County who submitted essays on their feelings about the public health issues in Wayne County. This program was started about 15 years ago as has these young people writing essays on abstinence, but this has evolved into a more pressing issue about the public health issues of Wayne County as seen through the eyes of the young people. This year we had 21 young people present essays, and this is up from only 6 from last year, so we're very proud of that. And Salita Graham has done a wonderful job as our education director at the Wayne County Health Department. I'm here to congratulate you. We have 3 finalists who will be submitting to the board their essays. Their names are Katie Wilder, Leighanne Stokes, and Carter Lewis. Those are the 3 finalists out of the 21. And again, I'm very proud to be able to do this, and I thank you very much, and you all have a good afternoon.
Hi, my name is Leighanne Stokes. I am currently a senior at Charles B. Aycock High School and will be attending East Carolina University this fall to study social work.
Hi, my name is Katie Wagner, and I'm a rising junior at Wayne School of Engineering. Right now at school, I play soccer, I swim, I run cross country, and in the future, after I graduate, I don't have very many plans set in stone right now, but I know that I want to travel and try to experience different cultures, and along with that, I'm interested in studying foreign language so that when I do travel, it's easier to interact with those who live there and not have to rely on a translator to get a more in-depth experience.
Hello everyone, my name is Carter Lewis. I'm a rising senior at Wayne School of Engineering, and after high school I plan to study either economics or political science at NC State University.
The topic I have chose is opioids. The reason I chose this topic is because I've witnessed an overdose, I have seen addiction, and I have family and friends that have went through this terrible time.
The effects of stress in teens' mental health. And the reason why I chose that topic is because when I first heard about the contest, I wasn't going to do it because of everything going on with school and then stuff happening at home with my friends, and just a lot was going on. But then I thought about the prompt and how I was supposed to focus on a health issue in my community, and I realized that up to that point my community had been predominantly academics based. So I ended up deciding that I could write about mental health and then stress, because stress was one of the main causes was academics, and I decided to focus on teens and how stress affected them specifically, because teens had a bunch of unique stressors like academics for one, and then family life, social stress, and then personal stressors.
So my topic this year was concussions or mild traumatic brain injuries, and I found out that concussions were not only very serious, but they also occurred much more often than I really expected to hear. The CDC said that anywhere between 1.6 to 3.8 million concussions occur every year in America, and concussions, they have serious consequences. They affect your language, they affect your sensations, the way you feel things, they can affect your brain permanently. So I just really felt like this is a topic that needs to be addressed, especially with how common high school sports are. I mean, many friends of mine play high school sports. So I just felt that it was a real issue that needed to be brought to the forefront of the public discussion.
In my essay, I included 2 types of solutions: the needle exchange program and the medicine drop event. Both of these solutions not only create a process of saving others' lives, but also an opportunity to grow our future.
If it were possible to set up something so that they can reach out to other people and not have it branded as like a therapist or a therapy, and because I feel like that's kind of stigmatized, because it makes them think that maybe there's something wrong that needs to be fixed, when in reality they just need like some way that they can let everything out. And I think it would be cool if they're able to talk with different people from a variety of different backgrounds that can empathize with them as best as possible. So I think that giving this opportunity to other people, like, you can't control what others are going to do, but you can give them this environment where they feel comfortable to talk about everything going on and maybe relieve weight off their shoulders.
In terms of concussion prevention, a certain part of risk is inherent to the fact that people are playing sports themselves. An average high school football game carries about a 15% risk percentage of someone getting a concussion. So obviously you want to make sure that there's safety equipment in place so these injuries are prevented, but the focus is really on treatment. Obviously, if an athlete suffers a concussion, they should refrain from playing and they should see a specialist immediately so they can get guidelines for how the injury should be treated. And before any of the sports even start, before anyone gets on the field, there should be baseline testing. So whenever a concussion is suffered, hopefully not, but if there is a concussion suffered by an athlete, the physicians will have a reference point of their cognitive state before and after the concussion, so they can more effectively manage and treat the injury.
Well, the reason mainly why I decided to do the essay contest is because that was right when my workload started going down a little bit, but also because I wanted to get the point out that mental health is just as important as other kinds of health issues, and that this would be my opportunity to talk about that and then specifically address the problems that are being experienced in teens. Because back to what I was saying before, identifying the stress is important in treating it properly, and since teens are they're sometimes associated with like raging hormones and like swinging moods or mood swings, then it might be harder. So I decided to do it mainly just to talk about the things that aren't talked about as much and something that would be applicable to everyone.
It gives me opportunity to further my education. It gives awareness to situations going on in our community and allows people to learn more about opioids.
I found an issue that I was passionate about, and I was able to write this essay. And I mean, you do get a scholarship from it. There are incentives to do it, but more importantly, you're able to just really get that essay writing skill. You're going to need that in college. You're going to need that on the job. You're going to need that wherever you go. So now is a great chance to practice. And not only do you get to practice that essay writing skill, you get to present to the Board of Health and explain your health issue so you can see that you're making a real impact in the community.
Thank you to the Wayne County Board of Health.
Thank you, Wayne County Board of Health, for the opportunity to participate in the essay contest.
Thank you for everyone at the Wayne County Health Department for this opportunity to participate in a contest like this. And I think I was able to get out all of my ideas in a method that I felt comfortable doing. And so, yeah, thank you.